Grace Health's Path to Prevention video this month is on medication adherence. Living with a long-term condition can be hard, and taking medicine every day is a big part of staying healthy. This video will show simple ways to help you take your medicine the right way. We will also tell you about support from our community health workers and Grace Health Pharmacy.
Hi, I'm Shannon, a healthcare professional, and today I'm here at Grace Health talking with Connie about a very important conversation, medication adherence. Connie, can you tell me a little bit about your role here with Grace Health?
I'm a community health worker here at Grace Health, otherwise known as CHW.
Awesome. And so, how many years have you been with the team here at Grace?
I've been here 4 years.
Wow, wonderful. So today we wanted to talk about something very important, taking medications and getting patients the support that they need to stay healthy. Remembering medications, understanding them, and paying them for them can feel hard. That's why Grace Health offers many services to make it easier.
That's right. Our goal is to help patients live healthier, feel better, and enjoy the best quality of life possible.
Well, let's start really simple. What does the term medication adherence mean?
It means taking medications the way the doctor or provider asks you to, the right dose at the right time for the right reason.
And why is that so important?
When patients take their medications the right way, good things happen. They can have more energy, feel less pain, stay healthier day to day, avoid trips to the hospital, keep doing things that they enjoy, like working, caring for family, and staying active.
Yeah, I couldn't agree more. Taking medications as prescribed, especially for chronic conditions, can help patients not only to feel better, but it also prevents those long-term complications, such as blood pressure medications. Taking blood pressure medications, studies have shown that it helps to prevent heart attacks and strokes. It can reduce everyday signs and symptoms like headaches, dizziness, and tiredness. But most importantly, it helps patients to live longer and to stay independent. Another would be maybe cholesterol medications like statins. Statins help to protect the heart and the blood vessels, and studies have shown that these medications help patients reduce their risk of a heart attack and stroke. And that means a better chance at staying active, traveling, playing with your kids or grandkids, and enjoying your everyday life. So medications aren't just about the numbers on a chart, they're really about how they improve your quality of life.
Exactly. Taking medicines as prescribed helps patients feel better and stay healthier for the long run.
Absolutely. And sometimes patients have a hard time taking their medications. In your role, do you find that that's common?
Very common. They may forget doses, not fully understand what a medication is for, worry about side effects, have trouble getting to the pharmacy, or be concerned about cost. And all of that is okay to talk about. Grace Health is here to help with every one of those challenges.
Wow. And so one of the biggest supports is the Grace Health Pharmacy. What makes it so helpful for patients?
Our pharmacy is designed to make life easier. Patients can pick up their medications the same day as their appointments. That means one trip to see their provider and get their prescriptions right away. No extra waiting or driving.
That's fantastic. And did I hear that there's 2 locations?
Yes. One pharmacy is at Grace Health main site campus at 181 West Emmett. The other is attached to Summit Point at 175 College Street, just 2 blocks from Ronson Battle Creek Hospital. Patients can choose whichever location is most convenient.
So what if a patient can't get to the pharmacy?
We offer free medication delivery within 20 miles with no limitation on what meds are delivered. The delivery is scheduled when a patient or someone else in the household is available to sign for it.
So I've also heard about med packs. What are those?
Yes, med packs are sometimes referred to as pouch packs. They organize the medications by day and time, morning, afternoon, and evening. They help the patients remember doses, avoid mixing up medications, feel more confident about taking them correctly, and are much easier to open than the traditional medicine bottles.
That seems like a really great resource. How can patients cut down on their trips to the pharmacy?
They can ask for 90-day fills of their meds or for fewer trips to the pharmacy, or syncing your medications so that they're all filled at the same time.
Okay, so can you tell me more about the RX Local app that's available?
Yes, the app is a great tool because patients can message the pharmacy directly and securely when it's convenient for them, see their med list and what meds need refills, add or set medication reminders, get alerts when prescriptions are ready, manage the medications for the entire family all in one place.
So it really helps patients to stay organized and to feel confident and comfortable communicating.
Yes. Yes, exactly. It helps remove barriers and make communication easy.
So another important resource that Grace Health is the community health workers, also known as CHWs. So can you tell me about this team?
Yes, studies show that basic needs can impact a patient's health. So Grace Health has 6 dedicated community health workers who focus on connecting patients with resources to ensure that their basic needs are met.
Wow. So what are some of the actionable items that you guys can help with?
We connect patients to resources provided right here at Grace Health and within their communities. Things like housing resources, food assistance, transportation to appointments. It's important to note that Grace Health does not have a transportation service, but we connect them with resources available through their insurance or within the community to get to their appointments. Also, we help with prescription cost help, insurance navigation, durable medical equipment such as a walker, a shower chair, or a blood pressure cuff. Also senior services, pregnancy, infant, child resources, and education on understanding healthcare.
So it sounds like CHWs really help to remove some of those everyday barriers that can make achieving health difficult.
Yes, that's right. We help connect the dots.
So how does your work at Grace Health and with this team support the Grace Health mission?
Our work goes hand in hand with Grace Health's mission, values, and vision. Grace Health's mission is to provide patient-centered quality care for the community. The vision is to be an open access medical home where patients feel welcome and supported. Our values focus on respect, teamwork, and caring for the whole patient, not just the medical problem.
How can somebody reach a CHW or community health worker?
Patients can call the Community Health Worker Hotline at 269-441-1949. Talk with their primary care provider about wanting to meet with a CHW or community health worker during their appointment. They can walk in and ask for help, or use the Grace Health website to connect with us at gracehealthmi.org.
So whether patients need help understanding medications, getting them filled, or finding support for everyday needs, Grace Health is really here to provide good quality service for the patients.
Yes, yes, you don't have to do this alone. We want to help you feel better and to live better.
So to get help, you can visit Grace Health's website at gracehealthmi.org. You can scan the QR codes that are on the screen, call the Community Health Worker Hotline directly at 269-441-1949, or talk to your provider during an appointment. You can also walk into any Grace Health location, either at the main campus, 181 West Emmett Street, or at the Summit Point location at 175 College Street. Thank you, Connie, so much for sharing the valuable work that you're doing as a CHW health partner and medication adherence, as well as all the great resources that Grace Health brings to the table for patients.
And thank you, Shannon.